right, so we're going to move forward on our agenda to the section on Community Health Planning Initiative. There's been a huge amount going on, as you'll see in the next few minutes. And I'm going to start out with a review of our Community Matters 2020. Just out of curiosity, how many people in here were involved in some form or fashion for Community Matters 2020? Just about everybody. Okay, so we're going to run through this. So Community Matters 2020 is what I referred to earlier, that MAP process, assessment, visioning, and planning for a healthy Jefferson County, Alabama. So this is utilizing a tool that's used by many public health departments. It can be used by others to help to do a community assessment, health assessment strategic planning process. And as I mentioned before, it uses this MAP tool, mobilizing for action through planning and partnerships. Okay, so you'll see down at the bottom of this slide, sort of complicated slide, but this sort of maps out how we do this process. Around the periphery, you see different assessments that we do. We did all 4 of these assessments over this past year. We started out with a organizing, and that was done by a core of staff at the health department, and then visioning, which was done by a group of leaders representing many sectors through the community. And then, as I mentioned, the 4 assessments. And then we identified strategic issues, formulated goals and strategies. So we've done all of that work, and now we're moving into the action process. So our vision statement, Jefferson County, Alabama is an inclusive, thriving community of healthy and connected people. That is our vision. These are the 4 assessments that were conducted during this past year. A community health status assessment. This was looking at the hard data, the health data that we have, things like infant mortality, life expectancy, crime rates, a whole host of things, poverty level, over 150 different data points that were collected that went into this to help guide us. There was a community themes and strengths assessment. This was a big survey of citizens of the community. Anybody that spent any time in Jefferson County could fill out a survey online or on paper to give us input into what was important to them from a public health standpoint, and what their assessment of that is. How are we doing in Jefferson County? And then we did a local public health system assessment. That was a big event held here with multiple partners that made up the public health system. And by public health system, we don't mean just the health department or other organizations that do health care or health work directly, but multiple entities that have an impact ultimately on the health of the community and the people that live in it. Things like schools, government, nonprofit, police, fire, policymakers, just a whole host of people, even the media. So we had people representing all those different parts of the system here to get together and sort of assess in a format similar to today, how are we doing in these different areas. Then finally, a forces of change assessment, looking at what are the things that are impacting things going forward in Jefferson County. Out of all of that input, huge amount of data, we came up with a community health improvement plan, otherwise known as the CHIP. And so this is addressing public health problems on the basis of all that input in the community health assessment. And we use that information then to set priorities and then coordinate and target resources with our partners. So out of that, we use the data to guide us. What rose to the top is the main issues. And we had about 10 issues that the data was pointing us to. And then we used that leadership team, again, representatives from different sectors, to look over that data. And we used a voting process, a weighted voting process, to sort of say, what are the issues that we really feel are most important and that we can really feel like we can take on over the next 5 years. And so here they are. So this is a big drum roll moment as to what we came up with. Number one is reduce health disparities associated with race, ethnicity, and economic status. And this was number one. This is what got the most votes, what we thought really rose to the top. The second one was to promote physical well-being through healthy lifestyles. Third is optimize the built environment, transportation system, and safety. Fourth, optimize healthcare access, availability, and utilization. So not just access, but appropriate use of that access. And then finally, improve mental health. So I'm going to just run you through this whole document. Our work plan around this is available on the internet, our Jefferson County Department of Health website. There's a box there on the screen labeled Community Matters 2020 that has all the details, the assessments of the Community Health Improvement Plan, a narrative that goes along with it, the whole process. But the work plan, that's basically an Excel spreadsheet that spells out what we're planning to do and who's responsible for it, and what the measures are, is 49 pages long. So I'm not going to run through all that, but you will be given some of those details later in the breakout group. So right now I'm just going to run through the major goals under each of these strategic issues, just to kind of give you a flavor for what we're looking at. So this is reducing health disparities. Goal number one, decrease the number of households living in poverty, a major determinant of health. Reduce food insecurity. Reduce life expectancy disparities between white and black populations. The second one, promote physical well-being through healthy lifestyles. The goals, reduce obesity among children and adults, increase physical activity, increase the number of residents protected by smoke-free policies, decrease the number of residents who are smoking, and to support various wellness policies. Under optimized built environment, transportation, and safety, we have improved availability, access to, and maintenance of locations for physical activity. Improve availability and access to reliable public transportation. Adopt built environment policies and enforce ordinances adopted. And then improve the safety of the physical environment. Our fourth strategic issue, optimize healthcare access. Goal number one, increase communication and use of health status data to help inform that process. Increase access to primary health care and dental care. And number three, increase preventive health screening. And our fifth strategic issue, improve mental health. Our goals, increase mental health services for children and adults. And number two, decrease illicit drug use and substance abuse, including abuse of prescription medicines, which is a huge problem in Jefferson County. So that's just a quick overview of our Community Health Improvement Plan. Again, more details later, and you can get access to all this through the Jefferson County Department of Health website. So we're starting today the discussion on how we implement this health improvement plan. The plan already includes not only those goals, but actual measures. We didn't put anything in there that didn't have something that's measurable. And there's much more detail in terms of strategies. And it also has lead agencies, people that have, or groups that have agreed to own that process or take a lead in that process. but it's very inclusive. So anybody that's not listed under any of those things is welcome and encouraged to get on board. It's a very, very ambitious plan. It's got a lot in it. We're talking about moving some major things here. It's going to take a huge amount of effort. So we need all hands on deck. We also need you all to be ambassadors to try to bring more people under this tent to get this work done. So again, it's over the next 5 years, November 14, so we've already started the clock to November 2019. The Health Action Partnership is all through that plan, but it's not just the Health Action Partnership. It is other community partners, all those different entities in this public health system. And again, I'll emphasize it's any of you that can help out.